Today I'm going to discuss a series of Office of the Inspector General reports regarding how they are looking at the Federal Bureau of Prisons, and I'll probably input some of the changes that have occurred as we've changed administrations in Washington, D.C. So the Office of Inspector General identified staffing shortages long before we changed to the Trump administration. And these shortages at that point in time, while they were a problem, this problem has really expanded uh, beyond what is considered acceptable. And not only in the Federal Bureau of Prisons, but throughout all of the agencies in our government. But we're just going to be considering or talking about the Federal Bureau of Prisons. And they have cut salaries from the correction staff anywhere from 10 to 35%. And they are letting go of a number of correction staff, not including the fact that senior staff, there's almost a dozen that have been let go or have retired. And that has, it's kind of like they cut the head off the snake. And so there's no one really in charge at the very, very top in senior leadership. Although uh, there is Director Peters has hired a law firm to attempt to get her job back, but I deviate. And so as a physician, my license is active and I'm going to be wearing my medical hat for the next couple of YouTubes. And so it's going to be critical from my perspective, that your medical record from the very, very beginning needs to be as comprehensive as possible. And by that, I mean, it needs to be complete. You need to have your personal medical record really complete. And if you're not sure if it's complete, you need to either hire someone like myself to go through it with you. But lawyers know the law. You can't expect them to all understand the medical side, but you don't want to learn that it's incomplete after you've been incarcerated. And we're going to go through some examples of why that's critical. And that's going to be because your personal narrative also is going to be important. And together, if you have everything ready before you get to the pre-sentence interview, that is going to be critical on so many fronts, if for no other reason than the probation officer is the most important person in your life by the time you get to that point. So none of this is new. Federal Bureau of Prisons has been having staffing shortages since forever. Project 2025 has created a paradigm shift. It's been an earthquake. Ongoing staffing shortages not only have increased, but their salary reductions leading to staff not being hired, but they're firing staff and staff is quitting. And the result among inmates is that you're having medical staff and teachers that are left not being able to see patients or to maintain first step back classes, but they have to sub in as correction staff. We have here OIG, Office of the Inspector General. This is Sheridan, where they went in and they saw there's healthcare shortages. They found that they had a backlog of 725 laboratory blood draws or urine collection samples, and they had 274 individuals still waiting to get x-rays. That's nutty. They had a high correction officer vacancy rate, which affects inmate monitoring. They found that the institution management was not always able to fill inmate monitoring posts. Therefore, it lacked the employees needed to safely supervise inmates. This is nuts. Psychology Services Department and Education Department staffing shortages resulted in significant increased wait times for inmate programs. I already said that, that the programs have prevented people from being able to utilize, for example, RDAP, the Residential Drug Treatment Program. We're going to go back here. Now we're going to go see December 2024. They did another inspection of Devon Federal Medical Center. And here they did a similar, let's see, okay, staffing shortages. They saw that 24% of health services were vacant, 39% of psychology services. The director retired in June 2024. They had one physician for 900 inmates. I mean, it wouldn't be total killer, except they still were missing vacancies in either half the institution's pharmacy positions and a quarter of its nursing positions were gone. And so, there's no way with a quarter of the nursing positions gone that one doctor can see 900 inmates. That's nuts. And so, these serious issues within the healthcare segment, it's a medical center. And so it's not really, it doesn't do well to have a hospital medical center not being able to provide hospital medical services. We shall continue. And then we just cite again, staffing shortages create delayed medical care. Psychology staff, teachers are subbing in as corrections. The number one thing that you can do before you get to your pre-sentence interview is to put together your personal medical record and narrative. That is probably the most important thing that you can do. And that's not only me saying as a doc, but federal Judge Robert Scalia. Don't wait to think about sentencing advocacy. Since 99% of federal clients are going to be facing sentencing, start preparing your case for sentencing as early as possible. Continuing, we're going to continue. Not to burst your balloon. This is a little old. This is in October 2022. Judge holds Federal Bureau of Prisons in contempt for allowing a man to waste away from untreated cancer. And I can go into the full article, but it's almost embarrassing. The judge was, not only did he allowed him to be released, the Bureau of Prisons wouldn't let him go. And so it was a fight between the judge and the Federal Bureau of Prisons. And finally, they brought him to, I believe, Dallas-Fort Worth Airport, and they left him on a bench there at the airport. They wouldn't even take him in the wheelchair through the airport to the plane. They just left him there on a bench, and then they took the wheelchair. You can read the whole article, but it's insulting. Judge blasts prison for providing, give me a minute. Oh, I can't do that. Poor medical care. And so the judge had to let this individual, Nick Bovis, out of prison early. And why did that happen? Well, the prison arbitrarily reduced the dosage of one of his blood pressure medications, arbitrarily reduced, and gave him a different medication that led to severe symptoms, including mini strokes, transient ischemic attacks. The judge didn't want to let him out of prison, but the only way to get him care was to have him go to a hospital. So it happens. And so I'm not involved in this case at all, but I'm curious as to how complete his pre-sentence interview was. How complete was his pre-sentence report? How much effort went into his administrative remedy process from home and from him while he was in prison? I don't know. Medications. The medications he was on, the one medication he was on, hydrochlorothiazide, is very cheap. They didn't give it to him. This is one page or one photograph of the BOP formula, their national formulary. They have about 3,500 drugs. And if you're taking a medication that's on that formulary, you think you should be given it, that you should get it. They have another formulary. It's called Non-Formulary. If your medication's on that list, you're not going to get it. You think you should, but you won't. You need to have a lot of time, every inch of several months, 3, 4, 5 months, however, as much time as you can get, because doctors and hospitals, these places are busy. And so you need to have your medical files from every surgery, every hospital, every diagnostic test, every nuclear scan you had, every EKG, EEG, every test that you've had, you need to have copies of. And most of them are also available on thumb drive, CD. And so you need to have both the typed report, but you also, if you can, get the CD or thumb drive. And so if you have the records from your physicians, you need to have the record of the prescriptions that you're on from your doctor. And if it's a non-formulary medication, you need to have every drug that you're on, and the doctor needs to go through every drug that the Federal Bureau of Prison has and why that drug will not work for you. Clearly spelled out. And the medications here, BOP formulary, and are yours listed? And are they or are they not? The formulary is all generic. There's a complete formulary list here. Non-formulary drugs, there's a complete non-formulary list. Therapeutic formula. Your attorneys know the law, but they can't be expected to know medicine too. Therapeutic equivalent drugs are drugs that they're chemically different, but they have a similar outcome. And so if you are dependent on certain drugs, and the previous slide or previous news article I showed you was pretty elementary, pretty cheap drug, and the nurse just arbitrarily chose on her own to change the medication, you need to be documented very clearly so that not only is it in your pre-sentence report, but that it's in the sentencing memorandum and it makes its way to the judge so that it's in the court order. The judge knows that the Bureau of Prisons will not take any order from any judge regarding treatment or specific medication. But on the same token, I had a client who their medication was not available at all. But the judge noted that. And by noting that in on the record, if the individual has a if his blood values and he begins to have medical side effects to not having the medications that have kept him healthy for the past number of years he's been alive, that will allow him to be able to write out request a compassionate release through second look act that the judge now may consider. And that's something we can discuss at another point in time. But having the drugs, even though it's on formulary, doesn't mean you're going to get it unless you go ahead and it's documented very clearly. Here, the medications, generic drugs, they all look different, but different, every single drug has a variety of different manufacturers, but they're all the same. Again, it's on formulary or non-formulary, you're not going to get it. And there needs to be reasons why that non-formulary medication is required to keep you alive. Continuing. If you've had a surgery and you're going into prison and you're either, or you have tinnitus, or you're older, or you use a cane or a walker, you don't want to have to climb and get on a higher bunk. If you had a hip surgery, a shoulder surgery, a hip injury, shoulder injury, knee injury, a back problem, tinnitus, ringing in the ear, falling out of a top bunk and having a hip fracture, that is for especially for seniors, that's probably a life-threatening recuperation from surgery, not the injury, but surgery to fix it. That has the highest chance of having people die from that particular problem. You do not want to have this. You definitely don't want to fall out of here. I know there's a ladder here in this picture, but most prisons don't have ladders to get into their upper bunk beds. For medical levels, medical level 1, you don't have a problem. If you're watching this YouTube closely, you're not going to be here. Where you don't want to go is here. Medical level 4 is the Federal Bureau of Prisons hospital level. The problem here is that if you think you're going to get better care here, that's not going to happen. Plus, they house violent and nonviolent inmates alike. And so not only are there more violent individuals here, but they don't have the staff. So, you're going to be short staffed and, you're going to be around people that may be more violent than you are. So now I'm going to show you here. This is a more of a time, or this is more of a labor intensive. It took more time. This client had more problems. And so this took more time on the defense side and definitely on my side. Person had pulmonary sarcoidosis. And so I had to write, this was the cover letter that will cover the next 3 packets. But I had to explain what sarcoidosis was, the medications that he was on. And I'm going to go through this very quickly. Review that in the federal bureau of prisons, there's mid-level practitioners and mid-level practitioners, pharmacists, they don't, and their availability is not that big. He was going to go to Butner. Butner had his challenges. This was right after COVID. Medications, there's no guarantee that he's going to be getting the medications. I went through basically the medications he's on, went through the history of what's available at the facility, plus how the the Office of Inspector General and what's going on between the Office of Inspector General and the Bureau of Prisons and the courts. And that's what here, courts relieve prisons because of BOP medical negligence, BOP mistreatment of dying inmate dying of cancer, courts questioning BOP medical care of COVID surge, stat report of last week, BOP has sound pandemic plan in place as COVID spirals out of control, et cetera. Then at Butner, there's a medium 2, low federal medical center, and medium 1, and the number of deaths in each place. Now I'm going to go through. This is a medical letter, and it was started by the family practitioner. And this is where she took the time. And again, this is why it takes a lot of time, because the doctors are busy and they just can't drop everything. And he was very lucky, but she typed out a great letter and went through the entire prison, the history. She took the time and explained the different variants and why the place is not that healthy, what happens in viral respiratory diseases, explain the matrix of how the BOP closes or opens up due to the pandemic. We all seem to not to remember how bad COVID was, but when I remember very clearly, then as New York City first got hit with COVID, and people were dying in the streets. This was nothing to laugh at, and now years later, people are complaining, well, they didn't need to close schools. Well, they don't remember. Now we're turning the clock around, and it is, at the end of March, and measles has started as a couple cases in Texas, and now it's in a half a dozen states. And so for anti-vaxxers, I don't have any, much sympathy, because you just can't turn back science. What's going on is different questions, methotrexate, and then we went into detail here as we wrote it kind of together that he's on methotrexate all the time, but the Federal Bureau of Prisons is only going to give it X number of days. And then we closed out this part of the letter and went ahead and gave the notes as far as index, where we got the information. And here are the individual letters from the individual doctors. All this, took time from both myself and then from the individual physicians. Again, they're not going to take their time. This is family practice. These are pulmonary specialists. And so gathering all this together is, going back and forth with the physicians. And as you see, they worked very well with him, this individual. And then we're going to get down here where copies. And so all of this went together to help put together a report which allowed him from a 3.5-year sentence. Eventually, he was released in 5.5 months. Now, it's not going to happen all the time. And I consider myself grateful that I was able to help participate in his, sentence reduction. But, it doesn't happen really all the time. Next, I'm going to be talking about the dark side of medicine or not medicine, but mental health in prison. I hope you found this helpful. I'm stressing the importance of preparing your medical record before you get to your pre-sentence interview. I cannot explain how important it is. And then being able to go ahead and defend yourself, or at least have loved ones work with you. We'll go through that to be able to fight for yourself and have loved ones fight for you once you're in prison. Hope you had a safe day and you found this helpful. Stay safe.